Healthcare outcomes in the United States versus developed countries. Despite spending nearly twice as much on healthcare per capita as other developed countries, the United States has worse health outcomes in many key areas. For example, life expectancy. The United States ranks 31st in life expectancy among developed countries, with a life expectancy of 78.6 years. This is lower than the average life expectancy of 80.9 years for developed countries. Infant mortality. The United States has one of the highest infant mortality rates among developed countries, with a rate of 5.7 deaths per 1,000 live births. This is higher than the average infant mortality rate of 4.1 deaths per 1,000 live births for developed countries. Maternal mortality. The United States has the highest maternal mortality rate among developed countries, with a rate of 23.8 deaths per 100,000 live births. This is higher than the average maternal mortality rate of 7 deaths per 100,000 live births for developed countries. Chronic diseases. The United States has a higher prevalence of chronic diseases, such as heart disease, stroke, cancer, and diabetes, than other developed countries. Healthcare costs in the United States versus developed countries. The United States spends far more on healthcare than other developed countries. In 2021, the United States spent $12,555 per person on healthcare, which is more than twice the average spending of $6,414 per person for other developed countries. There are a number of factors that contribute to the high cost of healthcare in the United States, including high prices for prescription drugs and medical devices. The United States pays higher prices for prescription drugs and medical devices than other developed countries. This is due to a number of factors, including the lack of government price controls and the high cost of research and development. Administrative costs. The United States has a complex and fragmented healthcare system, which leads to high administrative costs. These costs are associated with tasks such as billing, claims processing, and prior authorization. Lack of universal health coverage. The United States is the only developed country that does not have universal health coverage. This means that some people do not have health insurance, or they have high deductible plans that make it difficult for them to afford care. Conclusion. The United States spends far more on healthcare than other developed countries, but it has worse health outcomes in many key areas. This is due to a number of factors, including high prices for prescription drugs and medical devices, high administrative costs, and the lack of universal health coverage. What can be done to improve healthcare outcomes and costs in the United States? There are a number of things that can be done to improve healthcare outcomes and costs in the United States. These include negotiating lower prices for prescription drugs and medical devices. The government could negotiate lower prices for prescription drugs and medical devices, as is done in other developed countries. Reducing administrative costs. The government could streamline the healthcare system and reduce administrative costs by simplifying billing and claims processing requirements and eliminating prior authorization requirements. Expanding health insurance coverage. The government could expand health insurance coverage to all Americans, either through a single-payer system or a public option. In addition to these policy changes, there are also a number of things that individuals can do to improve their own health and reduce their healthcare costs. These include eating a healthy diet. Eating a healthy diet can help to prevent chronic diseases such as heart disease, stroke, cancer, and diabetes. Exercising regularly. Exercising regularly can also help to prevent chronic diseases and improve overall health. Getting preventive care. Getting preventive care, such as screenings and vaccinations, can help to detect and treat diseases early, when they are most treatable. By taking steps to improve healthcare outcomes and costs, the United States can create a healthier and more affordable healthcare system for all Americans.